All right, well, hey everybody, Dr. Bulow here with Laura Ellis of Bridges Acupuncture. And this is the first interview of the Pittsburgh Providers, so pretty cool. So yeah, you get to be the first. So this is an initiative that I started as a, kind of a goal to go in depth with providers, mainly for providers, but also for the community. So maybe someone listening in or watching the playback or joining us live will be a patient that's had chronic issues, that really is a well-educated patient and wants to ask detailed questions of the providers in the region, but almost selfishly, as a provider in the Pittsburgh region, I want to know. I want to know the details. I want to know the tests. I want to know when and if my patients would benefit from other providers' services. I don't know where that came from. But so that's what we're going to get into. I'm just going to ask questions that I'm fascinated by about your industry. But if you're listening in or if you're watching, you can ask questions as well, because I'm sure Laura will check back in, can answer questions. We'll have all of Laura's contact information with the notes on the interview here. So before we get started though, what would be your elevator introduction to other providers and patients? Like, who are you and what do you do?
Well, I'm Laura, and I'm an acupuncturist and practitioner of Oriental Medicine. So what that means is I practice acupuncture, but also I practice Chinese herbs. There's various Asian bodywork techniques like Tui Na, Gua Sha, cupping, which is probably what a lot of people have seen, like on the Olympic swimmers, the circles they get on their backs. Looks like they were in a fight with an octopus. I do that. Yep.
That's awesome.
So there's a whole lot that actually comes under my scope of practice. That's more than just acupuncture, but acupuncture is kind of the main thing that we do, and what most people know that I do. But the fun fact is that if you come in and you're really terrified of needles or just don't want to be needled for whatever reason, we don't have to. There's lots of other things that we can do that don't involve being actually punctured with a pin. So
here's my first question. Whenever you break down that, which is awesome by the way, because I think it's so important to clarify the landscape of what you do, because especially in healthcare, but in any industry, people have preconceived ideas, which isn't always the case. So here's my question. What is the foundation underpinning all of those things? So because there's so much similarity between acupuncture and chiropractic, just philosophically. But I remember in chiropractic school, they said there was the old timers gave the analogy of a three-legged stool for the profession.
Oh yeah.
And so you have the philosophy of chiropractic, you have the actual art of it, which is the doing, the technique, and then you have the science, which is sort of like how you understand all of it. One of my other mentors, a great guy who sadly passed away, named Andy Roberts, he said, well, the problem with the stool analogy is you could replace one stool, you replace a leg of a stool with like a guitar stand, and technically you could still call it a stool. So in chiropractic, the problem there is people could replace the art of spinal adjusting with, I don't know, colonics and cold laser therapy and still call it chiropractic, which we would have a philosophical disagreement with because it's not in line with the philosophy, right? So his analogy was the profession's like a tree, and at the base in the root system is your philosophy. It's your understanding of the world and sort of like where you gain knowledge from and kind of how you discern knowledge. And then the tree trunk is like the science. So it's like based on what you believe in your worldview, you study certain things. And then the fruit of the tree is the actual art. It's like what you come to then do. You know what I mean? And everything kind of like distills from one to the other. And I'm kind of curious because there's so many similarities. You rattled off a few things that you guys do in Oriental Medicine. But what is the underpinning worldview of Oriental Medicine? Because I have a feeling it's very, very similar to naturopathy and chiropractic and all the rest. But I'm kind of curious, from your perspective in education, what is the summary of that worldview? What does that look like?
Yeah, so it's very similar, like you said, because it's based on the natural world, and it's based on the idea of balance in all things. So in Chinese medicine, what it is, do you know the yin yang symbol?
Yeah.
Like that circle, and there's the
In
black
Pittsburgh,
and
we
the white.
say yin and yang.
Yeah. In most other countries, yin and
Yeah.
yang.
So it's
Yeah.
properly pronounced yin yang.
It's yang. Yeah.
Oh man.
Yeah, it's actually yang.
See,
Yeah.
I'm learning.
Yeah. So the yin yang symbol is the symbol of the Tao.
Okay.
And so Taoism is a philosophy. It's not a religion like a lot of people think it is. It over the course of its lifetime, over the thousands of years, they started adding some deities because Buddhism came into China and people were gravitating toward Buddhism because there was a deity. And so Taoism was like, oh, we need some deities to keep people in this philosophy. But really at its heart, it's a philosophy.
Interesting.
Yeah, and the philosophy is that there are, the Tao is the whole, so like that's the circle. That's like, it encompasses everything as one. And then the yin is everything that is cool and feminine and dark and still and moist, and it's the dark side of the mountain. Everything that you would find on the dark side of the mountain
Interesting.
is going to be yin. And actually that's what the symbol, the character yin represents. And there, if you look at the picture of the symbol of yin, it represents the dark side of the mountain.
Got it.
And then on the other side of that is the yang, which is everything that's bright and masculine and energetic and moving and warming and ethereal. You know, yin is very substantive, it's dense, it's earth. And then yang is heavenly, it's, you know, it's airy. And then the mountain itself is the Tao. Everything is encompassed within, you know, this mountain. You just have two different qualities.
Interesting.
And the two different qualities must always be in balance. You must always have both of them. It's not that, you know, one is good and one is bad. They are both necessary. And sometimes one of them gets excessive and the other gets deficient, and that's where illness comes in. So the idea between the medicine that I do is always just boils down to balancing yin and yang.
Interesting.
And it's that simple, but also that complicated.
I was gonna say, because in that approach, using our kind of like deductive process, it's sort of like, there's probably different tools and biological markers that you would use to see if someone is more dominant in one side or the other side of that mountain, right?
Yeah.
So actually, I'm guessing a lot of it is just intuitive and practitioner based, but are there like objective things, or like, do you measure blood pressure, for example, or like, you know, things like that kind of give you an idea, or is it just based on the case history, or how do you even go about diagnosing someone's overall balance?
So many different things.
Yeah.
I don't take blood pressure. I do take pulses.
Yeah.
Yeah, and pulse taking is not really about you know, the heartbeat. It's about feeling the chi, or the life force, as it's flowing through the body. But that can tell me if somebody is too yin or too yang.
Interesting.
And a lot of it is case history. A lot of it is what the person is experiencing.
Yeah.
It can be extremely physical, wherein if somebody is extremely overweight and tends to sweat a lot, they're very yin. They're too yin. They have too much substance, too much dampness, not enough of the movement in their lives, not enough of the warmth to transform that dampness into, you know, like, I guess like steam.
Yeah. For this.
Yeah, or a very young person might be too hot all the time. Like, they're always like overheated, they're always active, they never stop to rest, they never stop to meditate or be with themselves. They're just always go, 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 which tends to be our culture a whole lot of the time.
It's super fascinating, because over time, and I'm sure like what you're describing makes me think about it, how like over time you can start to, you kind of know, right? Like when someone comes in and you look at it, like you're saying, the case history, or in our case we do a lot of spinal imaging, but between the two you already kind of can, there's certain categories of patient that I'm guessing is kind of what you're saying. There's like certain categories you can be like, oh yeah, I know exactly what that is, and I know exactly what you need. And I'm guessing that's where you would plug in the different spectrum of modalities and things that you, or services that you provide. You did mention one thing that I just have to ask about, because we probably skipped over that when we started talking about diagnostics, was the idea of chi and like a life force kind of a deal. So how do you go from the Tao and the concepts of yin and yang to now the expression of that in living creatures? Because I'm guessing that's where chi comes in, but where does that come in the overall philosophy? Because I don't want to skip over that because I know, because that and meridian lines I've always had questions about, and some chiropractic schools teach all this stuff, mine didn't, and that's okay because I've honed in on what I do. But I've always kind of wondered where that all distills from. So if you, I'm curious.
Yeah, so Qi is the expression of yin and yang. Qi is sweat. It is muscles. It is breath. It is Qi is essentially everything, and we have different words to describe different types of Qi in Chinese medicine. But essentially, what I explain to my patients is that Qi, you can kind of just say it's energy. It's what makes you alive. You know, it's what gives you your life force, and it's what allows everything in your body to talk to each other. So yin and yang have this really cool relationship where they're mutually dependent on each other, and they're mutually transformative, which means that yin becomes yang and yang becomes yin as a natural process of the universe, right? Like the wave comes in and the wave goes out. Like that is yin and yang transforming into each other.
So holistically in the entire material world, you'd have an equal balance of both at all times. So you can't or can.
I wouldn't say it's an equal balance because it's not each of them the same level all at the same time. That's not necessarily healthy either because that's stagnant. You want change, but you want good change. You know, so you want the wave to roll in and cover everything with water, and then you want the wave to recede so that it can properly dry out.
Got it. Flipping a coin. Well, I guess So it's not, per the philosophy. It's not necessary to have perfect balance, like you're saying. Right. But there's an expectation of that change and flow. Right. It's interesting in chiropractic philosophy. The idea is that there's the triune of life. They call it is intelligence, force, and matter. So intelligence is the underpinning prerequisite to life. Like something has to keep matter in existence, but it does that through force. So force is like the unifying link between intelligence and matter, right? So like when you look at, and that force, our word force would probably be interchangeable with energy potentially, you know what I mean? But it's the idea that like all matter on a subatomic level has vibration and force to it, and where that comes from we have to deduce is intelligence, and we use the word intelligence because it's organized. You know what I mean? It's not chaotic, it's not random. Things are on an atomic level very highly organized with, subatomic particles and whatnot. I have to go back to my physics books. Quarks, I think they're called, like all these other like little material things. So the Qi then, and I'm trying to like match it with my own understanding of chiropractic philosophy, is almost like, it's the expression of those principles, I guess, but Qi could be both a material thing or an energy thing? Or is there a differentiation between? It can be,
but it actually maps perfectly onto what you were saying, where force is right between intelligence and matter. Because there's this idea in Chinese medicine also, of Chinese culture really, like Chinese medicine comes out of Chinese culture, right? And they're very interlinked, the beliefs in medicine and culture. But there's this idea of the three treasures in Chinese medicine. And the three treasures they're called Jing, Qi, and Shen. Jing is earth, and that's substance, it's yin, it's matter, right? And earth is Shen, and that's universal intelligence. Shen is the spirit, and that's, that's the ethereal, that's yang, that's how everything kind of connects on a more spiritual level. And the union, the kind of intersection between Jing and Shen is Qi, and that's people.
Oh, interesting.
Yeah.
So it's like they almost see it like you're saying, the expression of it all, kind of the link.
The manifestation of the interaction between yin and yang is Qi.
So where do meridian lines come in with all these conversations? Because I know that's somehow mapping or connecting or expressing these philosophies, right?
It is, yeah. Meridian lines are on the body, they tend to run up and down, and they're the lines that the Qi tends to follow the most strongly in the body. Now, as I said, everything is Qi, and so anywhere that you put a needle in the body can be an acupuncture point. It can affect your Qi anyway, but the strongest, we'll say, rivers in your body of Qi are on those meridian lines. Like I said, they tend to run up and down the body, and they each correlate with different organs.
Interesting. So, is there any biological, or I don't know if the word's Newtonian, or A to B to C connections, or is it all just clinical experience that this river runs here and connects with this organ, or are there like anatomical, here's a textbook and this is why this neuron links back to this cell in the brain which controls that organ?
Kind of both.
Yeah.
Mostly it's clinical experience.
Mm-hmm.
I mean, this medicine is thousands of years old. Some say it's like 5,000 years old.
Yeah.
So it's a lot of early trial and error over a couple thousand years to figure out the energetic maps of these.
Mm-hmm.
Some of the meridians do line up with like anatomical neuropathways, but like not enough for any kind of science to be able to say yes, that maps onto that. They are separate systems, but that's not to say that the one can't inform the other.
Is there any crossover between meridian points and all these things and like reflexology and iris analysis, like eyeball analysis and all that kind of stuff, or is that totally separate?
Yeah, definitely. And in fact, iris analysis is something that Chinese medicine uses sometimes. Not, I think, different methodologies and different meanings, of course. But yeah, when you're a Chinese medicine practitioner, you look at all of these things. You look at the eyes and the complexion and body type and and the idea with reflexology, Chinese medicine absolutely has this understanding, really deep understanding, that the body maps onto itself in a lot of different ways in a lot of different places. So especially in Korea, they use hand acupuncture a lot. So it's like reflexology, but the body's mapped onto the hand, and they do hand points. Ear acupuncture is really popular, doing stuff on the ear, and I do that quite often actually in my practice too. Yeah. Because the whole body maps onto the ear. That's wild. So yeah.
Right, yeah, the closest thing I think that we see in our offices of that is like people with the pierced traguses for the migraines, stuff like that. Yeah. Does that map at all, or is that where did that come from?
It does. No, it maps. I'm a little bit wishy-washy about what I feel about that because absolutely ear acupuncture is great and it works because it affects the chi that's on the ear that maps onto, where you get migraines, things like that. But to actually pierce it, to me, that creates scar tissue. Yeah. So it kind of deadens the piercing after a while.
That's a great point.
Yeah, the chi just finds another way to go around because I've got piercings like right here, right at my spleen, like liver area. And when I got this, one of my friends looked at it and was like, "You obliterated your spleen." I was like, "That's right. My spleen's fine."
That's hilarious. It's interesting too because there is this idea of there's a difference between facilitating the expression of health, or in your world we would call it chi, I suppose. They're facilitating the expression of chi versus trying to control it and trying to treat it, right? It's probably the biggest difference between things like chiropractic and acupuncture and naturopathy versus more Eastern medicine of allopathic medicine. I remember in early when I graduated, we had this lay lecture, that we would give the community, and one of the things we would do is redefine the term health because so many people have it so confused. But it's interesting because we would quote the definition of health from Dorland's Medical Dictionary. I think it says the treatment of disease by any means necessary, or the treatment of disease by methods necessary, something like that, to reverse symptoms or diseases, something like that. But health was like, that was the definition of medicine, and health was nowhere to be found in that definition. Because it wasn't based on health. It's based on here's a problem, and I, as the physician, am going to come in and eliminate that from your life. Versus, here's the problem, which is an expression of a body that's not functioning well, and now we're going to come in and try and help your body express health and life. You know what I mean? And that's when you puncture that, it's almost like a violation. It sounds equivalent to when someone just cracks their neck for back pain. You know what I mean? Like, if we're just cavitating joints for pain and range of motion, it's like, but that's like barbaric. It's almost like, whatever, but it's not refined, it's not artistic, it doesn't, it's you know what it's like? It's like, have you ever heard of, I'm trying to think of what it's called, it's like spinal manipulation under anesthesia. There's like an acronym for it. They literally put people under, and then like, for lack of a better term, rape their spine. I'm sorry, but that's to me what I hate it. Like, because they'll take the spine and just manhandle it, and which is, by the way, why a lot of principled refined chiropractors don't like the term manipulation, because that's you controlling the body in spite of what the body already has and what it's trying to do on its own.
Yeah.
You know what I mean?
Yeah.
Versus working with the body and the intelligence of the body to try and help it express what it wants to. So it's so fascinating with that. The whole ear piercing thing is like, oh yeah, that's like an allopathic way to try and manipulate a principle that you guys try and work with.
Doesn't address the root of it.
No.
It's like, where did that come from?
Yeah.
You know?
You'd probably appreciate this too. The founder's son in chiropractic, these were both very interesting, vitalistic, brainiac people. But one of them, I can't remember if it was the founder or the son, they had this principle of, they called chiropractic the above, down, inside, and out principle, ADIO. And it basically stands for intelligence and life flows from above, down, inside, and out. And the practical application was, you know, you have this intelligence, force, and matter, and it uses the nervous system to express itself in the matter, kind of idea. And that analogy kind of plays out because literally the brain's the top, and so it's above, down, inside, and out. You know what I mean?
Yeah.
But the reverse of that is outside in, below up. So it's sort of like you could, I suppose, be using these acupressure points in an allopathic, mechanistic, outside in model, or you could be using it from a vitalistic, inside out model if you're trying to help the chi get out or express itself. Does that kind of work?
Yeah.
Does that
Well,
make sense?
have you ever heard of dry needling?
Yes.
Yeah, so a lot of physical therapists do that.
Well, let's go there because I'd love to know the difference.
Yeah. Yeah, it's very controversial in my profession.
Interesting, yeah.
So basically what it is anyone who has some sort of Western medical license, like an MD, a physical therapist can go and take basically a weekend course in dry needling, learn how to use acupuncture needles to find trigger points in a patient's body.
Got it.
And go real deep and stimulate real hard with these acupuncture needles and get the trigger point to relieve the patient's
So are they
pain.
using, so first of all, and I'm sorry to cut you off, but I don't want to forget this. So are they using an acupuncture needle?
Yes.
So the dry needling is just a rebrand of the same tool, but
Yeah.
when it's used. See, that's the same thing.
It's the
Like,
same tool, yeah, but
Well, it's the same thing with us when people do spinal manipulative therapy. It's the
Yeah.
exact same thing. When people say chiropractors adjust versus manipulate,
yeah.
that's the exact same as acupuncture needle versus a dry needle.
Yeah.
It's theoretically the same, but it's totally different.
Totally different.
So go on,
They're
yeah.
not at all trained about qi or yin and yang. They're not trained about a healthy balance or, you know, revitalization. They're not trained about the philosophy of the medicine. There's none of that. There's none of, you know, the idea that, oh, if a patient has shoulder pain, you can actually use a point on the lower leg to treat that. You know, there's no idea of this meridian system at all. And so there's a huge, especially here in Pennsylvania, like I'm a part of a couple different, you know, like legal and organizational groups for acupuncturists here in PA, and most acupuncturists are really against the idea of dry needling because patients start to see it as acupuncture. They start to think that's what acupuncture is, and it's not it. There's so much more than that, and as licensed practitioners, we can do so much more for you than a dry needler can. And I agree with that, but at the same time, I'm like, you know, if a dry needler is able to help a patient's pain and get them better, why should I, you know, why should I be angry about that?
It's a tough place. I hear you. It's so crazy how similar some of these professions are, because that's exactly what you just described is like exactly what chiropractic's been dealing with. The problem is using it in an allopathic model like that is effective. So it gains in popularity because patients, God bless them, that's what they want. You want to be out of pain, so I'm going to go and this works great. But it's almost like using a Ferrari to go get groceries. It's like you know what I mean? Like you can do it fine, but like, oh my gosh, you're missing the whole entire point. Like you could have so much more quality of life if you're to use these tools what they're intended to do. You know what I mean? And in the process, get rid of your pain. You know what I mean? That's great. You know, it can help with that.
Right.
But my gosh, you could be sleeping better, you could be healing better. Like there's so many different levels.
I get people coming in for, one thing, and they'll come in a couple days or, a couple sessions later and be like, by the way, this other thing is fixed, and I didn't know that I was involved.
Yeah.
That's what this medicine does.
So when you're using acupressure, so actually, let me back up a minute. There's also there's this idea of acupressure points. Is that a terminology that you use, or is that a terminology that's been hijacked by like manual therapy that's doing some sort of like massage? I've heard of acupressure points. Is that Chinese medicine, or is that LMTs using Chinese medicine? You know what I mean? Like
it's LMTs using Chinese medicine. They're the same points.
Got it.
And I use acupressure sometimes, or something kind of like it. Again, people who don't like needles.
Got it.
So
you can stimulate it manually.
For sure. And I teach patients to do that too. I tell them which points would be good for them to do on themselves at home. Very cool.
So then what do you think is actually happening? Because I remember I had a conversation with another acupuncturist regionally, and it was so funny. I asked him, I said, so when you're putting a needle in someone, are you releasing this concept of chi and the expression of life and all this stuff, or are you bringing about a local injury for vasomotion and inflammation or inflammatory response and blah, blah, blah? And he goes, yes. It's kind of like both, you know what I mean? So I'm kind of curious on your take is like, so, because if you're counterbalancing this concept of dry needling and trigger points versus like activating a meridian line in your shin to help release a resistance point in the shoulder, how do you approach it? Like, how do you navigate between those two things? Is it one? Is it the other? Is one? Yeah, I don't know.
I mean, it is both.
Sorry, and not to interrupt. This is hilarious. I'm sure everyone can hear us because the mic on the phone is probably capable. But we're actually wearing lapel mics. It's not even plugged in. So I'm going to plug it in because it's the right thing to do. But it is kind of a funny little intermission here. Like, oh, this wasn't even plugged in the entire time. So sorry for the echo. It'll probably get a little better when I do this. All right. Sorry to interrupt there. So we were talking about the, so what is your approach on what you are doing when you are applying an acupuncture needle or applying a pressure on an acupuncture point?
So there's this saying in Chinese medicine that qi follows attention. Okay, so your life force follows wherever your attention is. So, and this works for everything, right? If you're worried about a future event that you have, your life force is going to that
#, law of attraction.
Yes. You're just leaking your chi everywhere by worrying about
I love that
things.
Concept, leaking your chi everywhere. I love that.
So what I do whenever so this is fun, and a lot of patients really find this fascinating that I do this, but like I said, I'll take pulses in order to diagnose what's going on, and I'll kind of feel how the chi is flowing through the body, and I'll hold on to the pulse with one hand, and then I'll start to test different points that I think may change the pulses the way that I want just by touching them. I'll just touch on various places, and I'll listen and I'll feel how the chi is changing through their pulses immediately. It's right away, and that's cool. Just by bringing their attention to these points. Now, by bringing, like, each point has a specific purpose. Like, it has things that it does. Like, some points direct chi downward, some points direct chi upward. Like, there's different things. So that's why I'm testing different ones to kind of see, like, if I bring attention to this function, how does that change the constellation of the body? So
if we have time, I want to go back in a minute to the different modalities, I guess, if you will, that you use. You know what I mean? In the very beginning, you're talking about the different things, and I'm curious how that, like, matches with this whole philosophy. Crap, I lost it because I had another question that oh man, I totally lost it. All right, we'll come back to that one. So let's go on to the second one then, which is how do the things like cupping or herbal things, from the outside looking in, I would think is it an allopathic thing where you're just trying to, like, increase circulation, or herbals to treat different diseases? Or do those also distill down to this idea of allowing the chi to fully express itself? You know what I mean?
Basically the second one, like everything allows that expression, that healthy expression of qi. And now since qi can be everything, I mean, qi, we can talk about blood as qi too. And blood is a big thing that we work on in Chinese medicine a whole lot. And this is capital B blood. This is like the juiciness of you.
Okay.
Right?
All right. So capital B is not blood like the things that comes out of your veins and arteries.
Not really, although we do treat that too. Like like bleeding is actually a technique that we do sometimes in order to relieve blood stagnation.
Interesting.
Right?
Yeah.
And that can help emotionally immensely.
Oh, I remember my question now.
Okay.
The classification or the types of patients that best respond.
Oh,
But
yeah.
Okay. But going back to
Yeah. So cupping and gua sha, which is like a scraping technique, it means essentially scraping out the bad stuff. And it does essentially the same thing as cupping. Those work more on the blood than the qi.
Interesting.
So we can kind of pinpoint a little bit more that way. And with herbal medicine, it depends on the herbs that you use, but it also a wide range. Some herbal formulas are really good at nourishing the qi. Some are really good at getting the qi to disperse. Some are really good at nourishing blood or getting the blood to disperse, or the yin or the yang, or things like that. The herbal formulas are really beautiful.
That's cool.
They're really amazing.
So it really is. It's again in my mind. It's like you have these allopathic. I keep saying, is the word Newtonian physics, or where it's like it's very linear, versus like non-linear thinking, where maybe someone can message me, let me know if that's correct or not. But there's like this worldview of everything connecting versus like this more vitalistic worldview where everything's interconnected, but to try and connect the dots is almost impossible because there's so many variables and so many infinite interconnections that it's like we just try and work with that intelligence that does all that instead of trying to control it, because that's like futile. You know what I mean? Like, but so I guess that's the answer though in your clinical approach, is that you're not necessarily trying to control the disease process as if it's a thing. You're trying to help rebalance the qi so that it'll just take care of that.
Yes.
Right? That's sort of, that's
absolutely.
Yeah, it's similar to us just trying to like allow the body to express life more properly, because life is so intelligent that if it can, it'll take care of it. You know what I mean? It's not like, you know what I mean? Like life's not, if life is so intelligent, which obviously it is, then it's like, why would it not resolve XYZ issue? Now there's certain limitations in our worldview, that in our philosophy there's two limitations. There's the limitation of time and the limitation of matter. So like all processes take time. So, but then there's also matter, meaning the intelligence of life can only work with the matter in which it resides. So if you screw up the matter, like if you get in an accident and you break off an arm, as intelligent as the body is, it's not going to recreate an arm. Or I don't know if that's the proper analogy. Or like you could eat Twinkies all day and you could make intricate neurological eye tissue, but it may not be the healthiest eye tissue because you're giving it crap. You know what I mean?
Right.
Like the body's like, okay, I guess I can build a house out of Legos, but it won't be as good as if I build it out of like proper steel and wood, and you know what I mean?
Right.
Like, there's limitations there.
Right.
But the concept is still the same, which is if life and qi and all these things, these principles are true, then our first job as practitioners of these healing arts should be to work with that principle and not in spite of it.
Yes.
You know what I mean? Like,
yes, yeah.
And that's where we cringe at like these gross spinal manipulations, probably the same way you cringe at dry needling, or just like you're kind of abusing the art form for a predetermined outcome, which you might even get, which is fine, but it's like,
that's not even an art form anymore.
Yeah, you're right. It's just a technical therapy.
Yeah.
Now, so here's, I don't want to forget the other question, which is like, so when you talk about a lot of these things, a lot of it is so, to use your term, it seems so young, if I'm using the term appropriately. It seems so intuitive and so like vitalistic that. Is that a prerequisite to doing well in an office like this? So I'm thinking of like now the conversation of like referrals and how would practitioners know like, oh, you know what? You'd be a good client for Laura. Like, do you get hard-nosed truckers in here that like, you're like, I'm only thinking of truckers because at the time of this recording, there's political stuff with truckers. So if you have like people who are like, I don't buy into any of that crap, are they going to do as well as someone who's like totally into energy work and does yoga 10 times a week? Like, is one type of patient like psychologically better for acupuncture versus another, or there's certain types of people or conditions that do really well or respond really well?
That is a great multi-layered question.
Sorry. It was building up there for a while.
So I guess, so whenever somebody asks me, can acupuncture treat X? The answer is always yes. The answer is always, this medicine has been in existence for thousands of years. They've figured out how to treat pretty much anything. The thing is that the relationship between the patient and the practitioner is pretty important. So you have to go with somebody who you feel rapport with, who you feel you trust, you know, and who you feel has like a similar way of approaching things. And I say that because like, so the trucker that comes in that's like, I don't know if I believe in this, but you know, whatever, it's my last hope. I've had those people come in and they've done amazingly well, even though I'm not really of that mentality.
Yeah, sure.
Typically, I tend to be a little bit more intuitive and touchy-feely about things. But they do well because acupuncture does do well for pain. They may do better with somebody else who really specializes with chronic pain and with like really like very yin physical stuff, right? Because I can do it because I've learned this medicine, but it's not my favorite thing. It's not what makes me go, woo, yes, all right, let's get you on the table.
What is your favorite stuff?
My favorite stuff is the more touchy-feely. I have anxiety. I feel like I don't have any motivation anymore. I feel like I can't see who I am, you know, like that sort of thing. Like that's what makes me go, yes, I've got so many ideas for you. I've got like, we can, you know, because I love the mind-body connection. Like that's what gets me really excited. So people who are more in touch with themselves do better here with me specifically, because we're right on that same level, and I can be like, I can feel their pulses and be like, ooh, your lung pulse feels kind of excessive. Are you grieving about something? And they burst into tears. You know? Man,
that's got to be so much fun.
It's
you know
so
what I mean?
much
Like,
fun.
it's so cool.
I love that.
Yeah.
You know, and like I said, the chronic pain people, I do fine with them. Like we have good rapport too. But like the people who like I recommend, and there's been people with chronic pain who I just haven't been able to do anything with, and that's when I'm like, you might want to find it's not acupuncture that's not working for you, it's probably me.
Yeah,
you know,
there's a concept in chiropractic that says don't question the principle, but question the application.
Yeah,
you know what I mean? Because that's interesting. That's why I love chiropractic so much, and I think acupuncture is probably a lot like this. And again, naturopathy is that like, it's a deductive philosophy. So like if your major premise is accurate, then a lot of these things that are downstream from that you should just have a lot of certainty with them. You know what I mean?
Yeah.
Now there probably is a line there, and there is a place for outside-in medicine. I mean, I always tell people, if you get in a car accident and you're bleeding out of the ears, don't come see me. Like you probably have an internal stroke or an aneurysm, and you need to that like medically fixed right away. Now maybe there'd be some Chinese medicine approach for that, but then you'd have the principle of time. Like, does the body have enough time to heal on its own, or does it need like immediate intervention right now? But it is cool, though. I guess my point is just when they have thousands of years of clinical experience, or if you have certain deductive truths that are just, irrefutably true, then you can. It's so nice practicing with that, because it's like a security blanket almost. We're like, oh, you're fine, like you're good, come on in, we'll see what we can do. Like it's not about me, it's about the principle, you know what I mean? So that's cool.
Yeah.
I'm trying to think if I have any other, we could probably get into the weeds with the different treatment options, but I don't know how much it matters at this point. It's like, I think it seems like it's just an awesome, beautiful healing art that can work for a lot of people if they're open with themselves and with you to trying it out. You know what I mean? Like, so I don't know if there's, because as soon as we start talking about specifics, it'll be another hour and a half conversation about each one. So I guess I would put that to you to summarize is like, how would practitioners know on a practitioner level the types of clients that they're seeing? I mean, the blanket referral would be like, okay, we do what we do and they plateau. So now we're going to try our Rolodex of providers that we have a good case history or track record with XYZ condition type or patient presentation type. Yeah. But I think the more refined question is, how would we know on the front end? You know what I mean? Like, how would we know on the front end of, maybe it's in the intake forms, maybe it's in the case history, maybe it's a test that we can do, but again, most of us probably wouldn't have the refined skills to take a pulse and touch pressure points. That's more your training. But like, how would we know on the front end or early on in the doctor-patient relationship, like, oh, you know what, I gotta put a little asterisk here to talk to Laura about this case, or talk to this patient about the possibility of coming in for a Chinese medicine consultation. You know what I mean? What are some of those things that we could look for?
I think one of the really beautiful strengths of East Asian medicine is that things that don't make sense in Western thinking makes sense in Eastern thinking. And
I love how that like encompasses the whole concept. Go ahead. You planned that.
Well, I was thinking about it as you were talking. I was like, I got the answer. Cool. No, people who come in and are like, I've had this pain and I don't, it didn't start from anything. I wasn't injured. Or I've even had this depression, didn't come from anything, nothing traumatic happened. I don't know, I just feel this way. That is really often easily understandable in East Asian medicine. And, and I've drawn connections for people a lot of the times. Like I had one lady, going back to the grief thing one time, who was like, I struggle with grief because I think she had lost both her parents and like a sibling within a year of each other, something like that. Wow. And then later on in the intake, we do a whole review of systems in the intake. And I was like, okay, so tell me about your respiratory function. And she was like, well, I've been having these chronic bronchitis episodes. Don't know why, they didn't come from anything. And I said, when did they start? And she was like, oh, I don't know. And I was like, did they start maybe around the time that you were grieving? And she went, oh, yes. So, by treating her grief, we were treating her bronchitis. So things, connections like that are just kind of obvious in East Asian medicine. You're just like, okay, if there's a lung thing, there's probably grief. So awesome. So when a patient comes into a provider's office and has just this huge constellation of things going on, and especially if they're things that don't seem to be related, East Asian medicine can probably relate them to each other.
I love that. And it stems, I think, from again that worldview that like these things shouldn't happen. You know what I mean? So there's got to be a cause. You got to look outside of the condition. You know what I mean? Where I think one of the biggest tragedies in traditional medicine is that we look at diseases as a thing, like as a substantive thing that we have to control and eliminate, where again, it goes back to this idea that like, no, that's a byproduct of a bigger problem. So we get so myopic in the condition, we don't look at the bigger picture, and it's just so much fun. Like I don't know if I did an interview with him yet, but I'm friendly and I would like to professional collegial with, I don't know what the term is there, with Dr. Daryl Misak. He's I want to do an interview with him at some point, but he's a great naturopath down in south of Pittsburgh. I'm trying to think of where exactly he is. But it's Reams, I think, is the guy, the godfather of naturopathy. You know what I mean? And they look to like balance the kind of like, I don't want to speak for them because I'm going to mess it all up. But it's like balancing out the body's chemistry. That's what it is, body chemistry. Where in chiropractic, we're all about balancing out the nervous system, and you guys with chi and everything else. And it just, a lot of those practitioners were looking at like holistically, and probably I would think Oriental medicine more than naturopathy and chiropractic, because they're just encompassing like everything. Where naturopathy kind of focuses in on body chemistry, we focus in on spine and nervous system, but it's like, but those kind of things, I think that's a great way to answer it, because it's like, yeah, it'd be almost like a disservice to say like, oh, someone with migraines, or like, oh, someone with trouble getting pregnant, or like, you know what I mean? Yes. Like, because there are these allopathic like things that are like, oh yeah, that's for this and that's for that. But it's more, to your point, kind of way more holistic. And so I guess that's just a good case history, you know what I mean? Or just when we're looking at things as practitioners saying it doesn't add up, that's even more an in-depth probably roadmap to you guys versus like it's easy for a patient to say like, this doesn't make sense. But if we're looking at their case history and their, you know, their test results and different things, and when that doesn't even make sense for us, it's like, oh man, that'd be cool.
Well, PTSD is one of those other things that can be really well treated with acupuncture, and something that I've been interested in and I've been doing more and more.
I'm thinking about that.
Yeah. I've had a guy in here recently who was, you know, just basically in fight or flight for a full 16 months, like could not break out of that pattern. And she is patterns, right? Like the way that your body is often gets stuck in a pattern. And after one treatment, he was doing much better.
Yeah,
you know,
that's cool.
It wasn't, you know, like we've been working with each other, and he's been doing much better successively over the time. But that one treatment did break the pattern. He actually got dizzy after that, and I was like, it's your chi reorganizing. Don't worry about it. You know, just stay calm.
Yeah.
You know, but yeah, PTSD can be really, really well treated with acupuncture.
That's super cool. I love that. In our work we literally have what we call pattern analysis. It's thermal, because thermal is controlled by sympathetic tone, and that's deep in your nervous system. So it's a great way to like track someone over time. But we literally call it pattern analysis, because people get literally stuck in these ruts where it'll be the exact same heat distribution again and again and again, which, to use a yin and yang analogy, it should be changing and fluctuating because the stresses of life are going to change, or it should just be calm and balanced where the temperature on both sides of your body are the same. Yeah. But very often when someone is stuck physiologically and physically and emotionally and all that, you'll see this heat pattern that's just like doesn't change.
Wow.
I had someone who came in for a consult one time and never moved past their initial visit, and then a year later they came back, and I don't know if they were trying different things or why, but they had the same dang pattern.
Wow.
And then we adjusted them, and like 20 minutes later it was like totally different. It was like I got your number, man, you know, like it was cool. So here's another, again, not to reuse the analogy too much, but the yin and yang to that question is, and I've never asked this question, but I kind of am curious, are there difficult patients or presentations or types of patients that you don't do well with? Whether it's results based, that just, it's not really an Oriental medicine issue, or personality based, that it's like they just really don't do well with us, you know what I mean? Like, so maybe some of those yin people like you were talking about that are just looking for pain relief are probably ones that you'd be like, okay, I can take care of you, but I don't find joy in it necessarily, or as much joy. I don't get excited as much, which is fair, by the way. It's totally fair, and that's a valid thing. There's a book called Book Yourself Solid, which is all about finding like your ideal clients, because that's when you're going to shine. You're probably going to give slightly better care as a result of that, as much as we wouldn't want to admit that. Subconsciously, we're going to find better care in the...
You have to take the ego out of it.
Yeah.
You have to just recognize you have some strengths and some weaknesses, and that's fine, and refer out your weaknesses.
So I'm curious, for the whole benefit of this group, what are some of those patients that you would, or the presentation types that you'd like to find solutions for, that you've had, you know, more often? How long have you been here, by the way, practicing?
Almost 5 years.
Yeah. So there may be some cases over the last 5 that you might see like a pattern of like, yeah, those kind of cases, or at least are more of a coin toss. Like half of them do really well, half of them maybe not so much, and we end up trying to find somebody, you know what I mean? Because I'm curious, because I think it'll be a benefit as we build these conversations and other people listen or watch them back, to come in contact with you, to be like, oh, those are my favorite people, you know what I mean? Like, oh my gosh, yeah, no, we need to get lunch, you know what I mean? So like, what would those categories of people be, if any?
You know, it's interesting. I had mentioned that chronic pain is just not my personal favorite.
Sure.
But I have pretty good success with chronic pain. So it's not like I'd say don't come in, or don't send them to me. Like I said, there have been a couple of people with chronic pain that we haven't really touched it, or haven't touched it as fast as I would expected with Chinese medicine. And so I'd say, and actually I don't really know any other acupuncturists that specialize in chronic pain in the area. If there are any out there, I would love to hear about them.
Or said a different way, like, who are some providers that you already collaborate with or find good synergy with when you're managing your folks?
Well, Daniel Johnson down at Fox Chapel, he's the acupuncturist. I think.
Oh yeah. Very cool.
Yeah, he's great. And I don't know many people down in that area, but whenever I do, and they're looking for someone, I say go to him. He's great.
Gotcha.
I feel a lot of synergy with him. As far as like naturopaths go, Tracy O'Neill over in Mars. She
cool.
and I have sent a lot of people back and forth, and she does intuitive work, like muscle testing. As far as herbal formulas, and I've even, when we share patients, I'll send her a list of formulas that I want to give the patient, like a potential Chinese herbal formulas, and she'll test them for me.
Oh,
to
cool.
see if they'll be good for that patient. Yeah. So we collaborate like that. I don't really believe in business competition, at least for my line of work. And then there are a couple of chiropractors in the area too that I send people to.
Got it.
And that's and a lot of times that's when I have these people that I'm just not really making headway with. Even with like the more emotional stuff that I feel like I'm better at, there are some people that, I don't know, for whatever reason, we're just kind of not nailing it. And I've got like Dr. Flick in Wexford. He's a tonal chiropractor. I've sent some people to him.
I was actually going to say tonal work when you were talking about a couple concepts earlier. I'm like, oh man, I wonder if you've gotten into the tonal world yet, because there's tonal.
I love it.
Yeah, I bet you do.
I'm all about it.
I think it was when you were talking about the waves coming and going and this and that, and focusing. Oh yeah, chi goes where your energy, where you're focused.
Yeah.
And it reminds me of a type of chiropractic called network. And it's a guy named Donnie Epstein is kind of like the grand poobah of network, and his son Danny Knowles, and they're great human beings. And when they work, and it's almost like points. It's almost like doing point work. It's not it's not like manual adjusting, traditional manual adjusting. It's more like putting certain points in, and I can't even begin to describe it. It's like a little union between chiropractic philosophy and maybe some of these access point concepts within Chinese medicine. Yeah. But no, that's very cool. I really appreciate it. I don't know if there's anything else, anything that we didn't cover that you would like to cover in terms of like for other, again, the goal of this was primarily for providers, but it can also be for critically thinking patients as well. But any last thoughts or things that you wanted to discuss that we didn't talk about?
Ooh, well, my favorite diagnostic framework is called the 5 elements within Chinese medicine.
Tell me about it.
Yeah, the 5 elements are great, and they're a derivative of this yin yang idea. Okay. They are water, wood, fire, earth, and metal, and it's a way of connecting all of these points that, like you were saying earlier, there's so many variables when it comes to patients and when it comes to people in general. And this is a way that really beautifully connects these variables together. It allows me to sit down with a patient and go, okay, you've told me that you have, you experience these things and these correlate with this element. And you've told me you experience these things and they correlate with this other element. And these two relate in this way. So you're probably feeling X, Y, and Z because of this relationship, and their mind just go,
yeah,
really? You must be psychic.
That's right. Like, who told you? Who told you? Yeah.
No,
Did Frank put you up to this?
I just love this framework, and it's so beautiful. It's so like it takes what we understand of the natural world and describes our condition, describes how we feel and the way that we react to things based on these natural things. So I've actually been thinking about putting together a workshop for providers on the 5 elements and how to use it in your own practice. So I tell people it's my job to fire myself.
That's right, yeah.
So you don't have to necessarily send someone to me if you realize, they're imbalanced in this way. You can talk to them in a certain way that speaks to whatever their dominant element is or whatever they need.
That's what my next question was going to be. Well, how could we use it if we're not, Eastern medicine practitioners. So you can take that concept of analysis and apply it in different ways.
Exactly. Yeah. Emotions and personality fit into each of the 5 elements really well. So for instance, our society is very, very wood because we're goal driven. Wood is about having vision and being able to see goals and then making that happen, making them manifest. And when we can't do that, we get frustrated and stressed and angry, and oftentimes self-righteously angry. Our society is very self-righteously angry. We have a vision of what America should be. They're not all the same vision, but we each have our own vision.
That's right.
And it's not happening, and so we're mad.
Especially now.
Why me? Why, victimhood is actually very wood, and that we tend to struggle with that a lot too. And the element that controls wood is metal. If you think about like metal pruning, shears pruning a bush or a bonsai tree.
Oh, interesting.
Metal can be over controlling. You can prune the bush too much and then the bush just can't grow at all.
Yeah.
But you also don't want the bush to just kind of like grow willy-nilly all over the place. You want to prune it so that it can grow and be its best, beautiful, tallest, biggest self. Right? And so the emotion that controls anger is sadness.
So the emotion that goes with the wood is the aggressive, goal-driven
anger.
So it's anger.
Anger.
Got it. Interesting.
Yeah. So helping, and then like crying and sadness will control that anger.
Interesting.
So not like I recommend people make their patients cry.
That's right. Yeah.
But if you can tap.
But it does release and break anger down.
It does.
Yeah.
Like if you notice something about them that you can kind of again build that rapport and tap into their emotional side, and maybe they can go home and cry or something.
That's right.
But like if you can build that trust and
interesting.
Yeah.
Oh, sorry about
that. That kind of relationship, and I love teaching my patients about that. So I've been thinking about putting together a workshop for providers on that.
Yeah, make it happen. Let us know. I think that's a great idea. I'd be fascinated by it. I always love like Myers-Briggs and what is it called? The disc analysis.
Yeah.
There's a couple others. I had a patient who wrote a whole book, and she's just like a brainiac, and she literally wrote a book on personality assessments. But when we started talking about it, I said, you know about Myers-Briggs, right? She goes, yeah. And she like as if Myers-Briggs was like down here, and you know what I mean? And like, so her whole way of looking at it was so incredibly like complex. But it's like stuff like that is fascinating.
Yeah.
You know what I mean? Just what makes people tick and how they what motivates them and everything. So.
Yeah. I thought of something else too. Send people with Lyme disease to me.
Oh yeah.
Yeah, because I haven't had tons of people with Lyme disease, but I've got a way to treat them that has been pretty effective, and I would love to learn more about it and get a whole lot of case studies under my belt with it. So.
Especially in Western PA, and
Yeah.
You mentioned the case studies, and we talked a lot about just philosophies of healthcare. Are there journals and are there scientific peer review processes within Oriental Medicine?
There are actually. The Journal of Acupuncture. Something that starts with an S.
Fair enough.
But yes, there is.
Cool. Yeah, because that'll be, I'm sure, and hopefully I'll do more of these interviews with acupuncturists and other people, because I'm sure people that are on the other side of the acupuncture spectrum, potentially, if there is a thing, without going too allopathic, that we'll talk about that. But it's just because the idea of creating case studies like that, it's like, it's great. Yeah, I'm sure that'd be very cool and very valid to see, because it's so needed. You know what I mean? Especially with Lyme, it's like, oh my gosh. So, this has been amazing. Like I said, I'll put in the show notes, if we want to call it those. It's not really an official show yet, but your information. And if you just let everyone know, like I said, we have for the providers in the region a private Facebook group just for providers called Pittsburgh Providers. And the prerequisite is you got to be licensed. And then we have one for patients called Pittsburgh Patients. But so join those if you haven't already. You can Google them up or search them up on Facebook. But my point here is, if you haven't joined it, join it. And then when you have that event or whatnot, just drop it in there. Let us know. I think it's a great idea.
Awesome.
So,
Cool.
all right, guys, that's it for today. Thank you so much for hanging out with us. Thank you, Laura. This has been
Thank you, Ian.
enriching for me, and hopefully it has for you guys as well. If you have any questions for Laura, please don't hesitate to reach out. Really cool clinic here in Harmony, PA. It's a beautiful little building, and you've got a great little synergy with a lot of subleases and things. We talked about that personally before the show, and but yeah, thanks again. Thank you, Laura.
Thank you, Ian.
All right, we'll see you guys. Bye now.